It's Phil Ratcliffe with Rebel Financial, and thanks for turning in again to one of our Rebel broadcasts. Today we're going to be talking about healthcare options, just kind of high level, talking about group health insurance to individual to Medicare, and some of the alternatives, and even some small business stuff. So we are going to hit things pretty fast. So stay up, Tony, with me always. Yeah. Us kind of doing this together. Join the conversation below. Some more information will be available from what we post below on Facebook and YouTube, etc. So you can follow some of those links. So, first of all, we're going to start out probably with the thing that most people are used to, and that is your company group health insurance.
Yeah, and different ways to get it. So the good thing about healthcare for us is it's good job security. There's so much going on right now, and it changes seemingly every year. But as small businesses, especially, not great options, but you have a number of options
that people aren't aware of.
Yeah, and other kind of government subsidies, so to speak, through taxes and credits and things like that. So
for the majority of you still working, you're going to have your group health insurance because still the majority of people work through larger employers that are more than 50 employees. And of course, generally, again, it can be differences from company to company. You're going to have your open enrollment at the end of the year. You're going to use the tools that your employer or the health insurer that they selected to kind of see what your options are available to you. And it's very important to do that every year because health insurance is just becoming a bigger and bigger and bigger expense. That's why it's at the forefront of everything, because it's really sucking the life out of, a lot of middle class and lower Americans to go from just a few percent of their income to now 10 to 20%. It's a bit outrageous,
especially if somebody in your family gets sick,
mm-hmm.
and if it's a pre-existing condition, it can really hamper your options and put a lot more cost on the family.
So make sure you go through, use the tools that they have, take into consideration, if you're on one of the more expensive ones, plans that covers a lot of things, and all you do is your preventative health care, you might want to seriously consider using the high deductible plan. And hopefully the company matches into your HSA or which is a health savings account. This is a retirement account that when you put into it, if you don't use it, it keeps building up year after year after year. And you can actually pick investments in there just like your 401k. So hopefully over time you build up a good amount in there and it grows even more for you. You could be in the opposite situation where you picked a high deductible plan in the past, and now with either you or someone in your family, their health has changed or situation has changed where you're going to use a lot more health care. You need to get into there and flip into one of the more comprehensive ones. So you should just be checking these things to make sure that you're in the right plan, and that over the long term it's going to be the most beneficial to you.
Yeah, and it's a good time. That's a popular time for us to be talking to our clients to help them work through those benefits as well. So if you have an advisor, go through it with them, or if you're our clients, we're happy to go through that with you.
So again, we can't get into too much detail on that because there is so much variety between what your employer has set up. I mean, the main thing is, number one, make sure the plan is right for you based on what's going on in your life and your healthcare situation. Number two, if you can, use your HSA, and you should even be maxing that out generally before your 401k or IRAs or Roth IRAs or so, just because you're going to get to put it in pre-tax. You're going to get to, if you use it right, you're going to get to use it, or it's going to get to grow tax deferred, and then you're going to get to use it tax free. So that's better than generally pre-tax or Roth, where you only get 2 of the 3. Your HSA and even FSA. The downside of the FSA is generally use it or lose it, and you can put less in. But if you're going to have expenses, use it. So make sure you got those. If you have more questions than that, hit us up or your other advisor, and they can help you with that. So nextly, we're going to hit into Medicare.
Okay, so Medicare, obviously, we, for those getting older know what it is. You got to get it at 65 unless you're already in a plan. Maybe you're still working. You need to sign up for this, and it's important because you can get penalties if you don't. So
for the rest of your life, it'll hang around.
For the rest of your life, you have a permanent increase in your premiums. But you have 3 months before your birthday month, then your birthday month, and then 3 months after. So you have
at 65.
At 65, right? Your 65th birthday. Good point. So, yeah, so that's important. So get that window, otherwise you're going to see an increase. So
I mean, there's an exception, obviously, if you're still working. then you have that same kind of time period after you terminate, for the life event. So most people will enroll in Part A, even if they're still working at 65, just to get it done, get the enrollment in, because for most people, if you have more than 10 years worth of work, then your A is going to be free unless you're making a lot of money. There are some exceptions. Again, talk to your advisor in terms of your personal situations. But most people will enroll in the A and then they'll defer on the B until their group insurance is up. So just FYI, if you're close but not there yet, that's going to be your general kind of war plan right there.
Guideline.
Yeah.
And the B, people hold it off because there is a premium, right? $135.50 at the low
And
end.
it changes every year. And again, just so we're not just assuming everybody understands that, Medicare basically they have the A, B, C, and D. And so most people, you're going to have the A and the B, which is your primary coverage, the hospital coverage, and all of the ancillary services that come around with your doctors and primary care, et cetera. And I think it is upwards of, covers upwards of 80-some% generally of most costs or what so. Then you may have heard of a Medigap or Medicare supplement plan. And after the Bush tax went into effect, they made Part D, which is drug coverage. And so generally the Medigap policy can or cannot include the Part D drug coverage. It's up to you. Whichever one you pick is going to change the cost of it. And so most people, if they're in the original traditional Medicare, you're going to have A, B, and then you're going to have a Medigap or supplement policy that a lot of times will include D. So that is the original traditional Medicare. And then you have what some people call Part C, more commonly known as Medicare Advantage. Basically, you opt out of the traditional Medicare system. The government gives the money that would have gone towards you to whatever, healthcare organization that you went through, whether it's Aetna or Medical Mutual or whomever. And so, I would say with the traditional, it's probably a little bit more comprehensive, but it's going to be a little bit more expensive. When you do Medicare Advantage, there are opportunities for savings, especially if you like the network. But again, you really need to, we don't want to get into the weeds on this, but you need to talk to an advisor or an insurance agent that this is what they do all the time so that they can shop for you. The one caveat we throw out there, don't just trust any insurance agent because the premium on Medicare Advantage, even though it may not necessarily be coming out of your pocket, is a lot higher. So insurance agents do have a conflict of interest in selling Medicare Advantage plans versus the traditional. But there are lots of situations where it's good. So again, it's just good to know what the conflict of interest is when you're going to use someone to help you.
And it seems a lot more confusing than it is. Once you finally get a handle on things, it's not as bad. But so keep that in mind. Understand what A, B, C, and D are. Understand the costs and when you need it and when to sign up. And if you at least get those things under your belt, you're going to be okay.
Yep, and then you're going to have open enrollment, kind of like the group health insurance, generally from mid-October until the first week of December. And so whenever you start thinking about Turkey Day, that's when you say, hey, I got to think, do I need to revisit what I'm doing with my Medicare? So whether you need to change your supplement plan or whether you want to switch from Medicare Advantage to traditional or vice versa. Again, there are caveats with that. And some people, you don't want to just make that jump without a good bit of due diligence. But that is the time frame to make those changes if you want to do it. If you're in Medicare Advantage, there's a different open enrollment from January 1st until March 31st. So we're in the middle of that. So if you want to change from one Medicare Advantage to another. So again, if you're really doing that, you probably should get some help either from an advisor or a health insurance agent that can really go out there and shop, because it can be meticulous and you can miss things and think you got a good plan, but it doesn't cover some drug that you're on. It could be bad. So get some help on that. So,
and we have a couple of good relationships too. So whether you're a client or not, let us know if you need help on that.
Absolutely. So the next we're going to go into private insurance, ACA, also known as Obamacare, and then some of the newer short-term and alternative health insurances. So I'll let you start.
Yeah. So again, hopefully, there's such a range of how you can get health insurance when you're below 65. So hopefully your company is, And maybe if they're larger, they've got something in place and it's pretty consistent, but it does change every year, so you could get that. You could just get your own private insurance. You can go just get an individual policy. That might be better than what you even have at work. And if you're in pretty good health, you have a number of options, including not just regular health insurance, but sometimes short-term health insurance can be a solution for you as well. Again, going back to the Affordable Care Act too, if you don't have those options, you can always check out the Affordable Care Act, and depending on how much money you make, that will drive the cost often. But you can easily find a website to talk about those things.
So definitely, if you're in between jobs or what's and your income's going to be down, or you have a bigger family and you went from 2 to 1 income, definitely check out the ACA first, because with the premium tax credit you can get from the government, which they give you up front to make the insurance cheaper, you may be able to get a lot more comprehensive policy for a better price. So don't just think about the sticker price. So that's where the ACA is going to be the strongest. Now, I like to refer people again to using someone that can shop the health insurance for them, because they'll shop the ACA, they'll shop the private insurance, and even maybe give you some of the alternative options. And then they can do that all in one thing, because they could get paid either way, right? And I don't think there's as big as a conflict of interest, because the commissions have kind of been capped on that. And so obviously a bigger premium would be better, but beyond that, I don't think there's as much of a problem as there used to be in the past. So, look at ACA first, then the private insurance if you're not going to get any premium tax credits, because the private just might be less if you're going to have to pay the full sticker price. And again, this is kind of like the Medicare. You got an open enrollment period for this, so November 1st to December 15th. And, obviously special things, if you get laid off, or, you're in between jobs, or, something comes up that changes your family circumstances like that, you can have a special enrollment. So main thing, you need to shop to make sure you get the coverage that you need and you get a good deal on it.
Yeah, and I'll second what you said. Find a good expert like the ones we work with, and they will be able to help you look at all those different options.
Yeah, one of the guys we've used a lot, he's even helped a lot of our clients, is Sean Tonetti from the health market. So again, if you're around here, that's a good resource, but ask a reference or your own local advisor or attorney or accountant or a lot of times they'll know somebody that has helped multiple of their clients, which is a lot better referral from the fact that we'll refer multiple people to them. So it's not just a one-off thing that they're trying to maximize their commission. A lot of times they want to get referred again. So, in that respect, they're going to take more due diligence to possibly take a lot lower commission to do the right thing, because they're trying to keep their relationship up with someone like us, right. So that's nice. And then, the shopping thing, we've mentioned it really quick with short-term and alternatives. Some of the alternatives that were available out there were with some of the religious groups kind of doing some of their own self-insuring things. That was kind of an exception to the ACA penalty rule. But now that they've kind of stripped some of the things away from Obamacare in terms of like the individual mandate and the tax penalty and you're seeing a lot more what's called like non-compliant plans, but without the penalty. They're available now. So you can find plans now that have caps on what's the maximum benefit that you're allowed to get, different kinds of deductibles. And you may, I was just playing around with it before we got here. And, for my family on a private ACA policy, it's $1,000 to $2,000 a month premium. But you could do a short term that was capped at $2 million and, is, $10,000 deductible instead of $500 or $7,500. And I could bring it all the way down to $300 a month. And so again, most of what you're looking for is the catastrophic coverage on this stuff. If you are in a shorter term type thing and you have the ability, it would really suck to have to pay $30,000 out of pocket if your whole family got a car wreck but it for most people, that's not going to ruin you for the rest of your life if you went without insurance and had $1 million in medical bills and had to claim bankruptcy, right? So there are more solutions out there that doesn't happen. And so I think we're gonna go down one or two paths, and obviously this is up there with the elections and stuff. We're going to probably go to where they gut this thing more, and there's going to be more options out there. And eventually, we may end up even losing the guaranteed insurability thing, which I think would be bad, but it will make things more affordable for most people again. Or we're going to go the opposite way and get some kind of Medicare for all. So, I mean, we'll have to watch it. Obviously, this is going to like change. And so, but you know where things stand, at least for this year. Right. And probably next year as well, too. So, next thing we'll hit on to small business plans and options and what. So this is a hard area, you know.
Well, yeah, I mean, here we have a small business, and it's just difficult to be able to fund the expenses. If you truly want to know how much your health care is, you can look on what your employer pays, look on your W-2, and you'll see a line item at the bottom there.
And it's amazing.
It's often over 20-something thousand that each employee is getting a benefit for. So for many small businesses, that's nearly impossible. It's crushing. It's impossible. So, but there are some help within the guidelines of the government that can help alleviate some of that pain for employees when they're shopping for their own.
And you may have heard a lot of these things, but generally employers that have more than 50 employees will generally, everybody thinks they're required to have health care or offer a group policy, but that's not necessarily the case. There's just a penalty if they don't. It's like, I can't remember the exact name, it's like a shared responsibility like fee or something like that, or tax. And so, you know, if it's larger than that, that's generally why you're going to have the group health insurance at work or whatever the case, because of two things. Obviously, the penalty makes it more worthwhile to want to give the money to your employees rather than straight to the government. And secondly, the bigger you are, when you are probably pretty big and have lots of money, it just looks pretty shabby to not offer insurance. So a lot of people don't understand that. But if you are less than 50, this is really what we're kind of talking about here, because it's hard. And you know, if you're a smaller business, it's a huge line item. And the group policies that most of us are eligible for are a good bit more expensive than the individual policies, which doesn't quite make sense to me. But it makes it even more difficult that smaller businesses and organizations that have the least resources are basically being required to pay the most. And again, it just creates this revolving cycle of unaffordability. So there are a couple different options. So if you are going to pay for and do a group policy, then there's a SHOP program, which is kind of through the ACA, to where smaller businesses of less than 50 employees can basically subscribe to this. And basically all of the ACA policies are pretty much available for their employees. And a big reason why people would choose to do this as well is that if you pay at least 50% of your employees' premiums, you have less than 25 employees, and their average salary is below $50,000, there is a small business tax credit of 50%. So it could be significant. So like it could actually be a very affordable way to do it. But again, that's a lot of hurdles to jump over right there to make sure you qualify for that.
You got to spend money to make money on that, and then on the type of business it is, you don't always have employees that are under $50,000.
Yeah,
you know, and that's many is probably most, but still not all.
So the next thing is something kind of near and dear to us. We've recommended it to multiple small businesses, but using HRAs. So accounts basically where employers can put money to reimburse their employees for medical expenses / premiums. So the first one was the QSE HRA. Again, we'll put some links to there. The company that we personally use is called Take Command, but there's a couple of them out there that'll help you make the administration better in terms of tracking to make sure that people are eligible, that you're reimbursing correctly, and documenting it so that the business can take a pre-tax deduction for giving the employees money, and the employees can get it tax-free, just kind of like a bigger employer paying the premiums for the group health insurance. And so with the QSEs, you know, again, you can look into this, reach out to us, check out that Take Command page, and we'll put a link to a couple others as well too. They have good descriptions of how everything works and get more into the details, and they'll even have a phone conversation with you or chat with you to answer what's best for you. But generally with that, you'll just have like different levels of saying, single, married, family, and you can have different levels of reimbursement for that. Generally, it's individual coverage, but it can apply to other spousal coverage, et cetera. There are certain rules for it that you can still reimburse or that they would be eligible for. And you just set a level of reimbursement you want for that. A new one that just came out starting at the beginning of this year is called individual coverage HRA or ICHRA. And that one is a little bit more restrictive in terms of it has to be individual coverage. It can be some other group plan or spouse's plan or whatever the case. But it opens up a lot of more possibilities. So in terms of just having, based on what they're signing up for, you could say, well, my interns are not eligible because they're less than 40 hours a week. You could have somebody that's a junior marketing assistant that's eligible for $50 a month reimbursement. And then say an associate marketing person might be eligible for $150 a month reimbursement. And an actual, marketing, let's go all the way up. You could have some more middle ones. They say a marketing director is eligible for $750 a month reimbursement, right? So the people that are more critical to your business, that have put in tenure to be around and are helping, you can reward them more and provide even a better benefit than the bigger companies and have it tiered out. So this is a great option because, like we had mentioned, a lot of the individual policies are less expensive than the group policies. And if you do have somebody that, say they're a one spouse family with 3 kids and or 2 spouses, but only one working, and even though you may pay them pretty good, they may be eligible for a tax credit, right? And so now they can't get the HRA money plus the tax credit, but the tax credit may be a huge savings, and they could do a gold plan. And so again, instead of small businesses getting punished, like it kind of is if you go the traditional route, there's a little bit of a subsidy there, which in my opinion is how it should be, right? So.
And the good thing about, from a small business point of view, it's a lot more predictable in your cost. You could just make it streamlined and even and not have to worry about fluctuations that small businesses have.
Yeah, because that's a horrible thing. I mean, I know in multiple business owners, even my dad's optometry practice, there's been years where the medical premium increase when they see it. There's like, holy cow, this is like hard, harsh. And it doesn't even make sense based on the claims experience of that group or what. So, and that unpredictability is bad, for someone trying to make it.
Yeah. So here's a way to be able to alleviate that a little bit.
Well, thanks for joining in. If you didn't catch our last week's on tribes, go back and watch it. We'll probably have next week off. So I hope you guys are having a super end of February and things are warming up. And of course, make your comments below. Check out all the links we put to the resources. If you need our help, just reach out to us. We're always trying to help people. Make sure you reach out to your advisors or whatso if you have them. And again, thanks so much for tuning in.
We'll see you in March.